Now let's talk about your pain. Hopefully here in the hospital we've found something orally that's working well to control your pain. When I say well, meaning that you're able to get up and participate with therapy and do your exercises, you're also able to get up and go to the bathroom if you need to. When you go home, it's very important that you follow these same precautions to give yourself the best outcome for pain management. So when you're home, you're going to follow that same pain scale that we use here in the hospital. When your pain level is a 3 or a 4, that's when you want to medicate. You're not going to wait until your pain level is way up to a 7 or 8, because by that time, you're going to be chasing that pain. You're never going to get caught up. So by being proactive and preventative, you're going to have the best outcome for pain management. Also, when you take your pain pills, it's very important that you always make sure that you either have something in your stomach or you take a little snack. It doesn't have to be a full meal, crackers, milk, yogurt, just a little something to coat your stomach. Get that in your stomach first and then take your pain pill. Also, it's really important to track and write down the medications that you're taking. We will send you home with one of these pain medication records that you can take home, and also follow with the date, the time, what your pain score is before you take your pain medication, and then also the dose, so that you know that if you're taking 1 or 2 at a time. Give yourself about a half an hour, 45 minutes for that pain medication to kick in. Then you're going to write down your pain score again. Ideally, obviously, we want to make sure that that pain level is coming down. But if for some reason your pain level is not, or even if it's increasing, you're going to want to make note of that. This is a great communication tool. So if you're finding that your pain is not being well controlled, you're going to want to notify your surgeon and let him know. And this is a great way to communicate that with him. Also, with the pain medication, one of the blessed side effects that comes with pain medication, constipation. We've already talked about this a lot, we've covered this, but it's very important that you stay and be proactive with that as well. With the surgery, we've given you anesthetic that slows down the gut. You're not up and moving around like you normally would, and now we've thrown narcotics on top of that, and that also shuts down the gut. So all of these things contribute to you having issues with constipation. So here in the hospital, we've had you on a medication, a combination stool softener and laxative. We highly recommend that you continue to follow that same regimen at home each and every day while you're taking any of those narcotic pain pills. Also, other things that can really help with that, the more that you're able to get up and move, the more you walk, that helps stimulate the gut and that helps it keep moving as well. Lots and lots of fluids, healthy water, juice, Crystal Light, those non-caffeinated beverages to keep you hydrated. Also, healthy diet, lots of fresh fruits and vegetables and the lean proteins, those are also going to help with the constipation. Also, in your paperwork, we have tips and prevention and management listed for you for any issues with constipation. Definitely follow and refer to that if you have questions, or you can always contact us directly here at the hospital and speak with one of the coordinators. All of these things will help to give you the best outcome for your pain control as well as your activity. Let's talk about the prevention and management of blood clots. After your surgery, we take a lot of precautions to help minimize the risks of that. You're placed on a medication to help thin your blood. We have leg squeezers, or the SCDs that are placed on your legs, and it's a mechanical device to increase the circulation in the backs of the legs. We get you up and walking right away. That's a great way to really help that circulation moving in the backs of the legs. And then we teach you to do those lovely ankle pumps and ankle rolls. Anytime you can be thinking about sitting in your chair, bed, whatever, watching TV, just keep moving those ankles, and that's also going to help keep that circulation moving. Some physicians go above and beyond that, and they have you wear these lovely Ted Hose stockings. Basically, it's just a long compression sock that you'll wear from anywhere to 2 to 6 weeks, depending on your surgeon's preference, and that will be highlighted for you on all of your paperwork. These are designed, like I said, to compress the legs to help with swelling. Usually, you're going to be wearing these pretty much all the time. You can have them off for about 2 hours a day, so around the time that you shower, you can take them off, let your legs air out and breathe, and then you put them right back on. Yes, they're tight. They're a booger to put on. We all hate wearing these and putting these on too. A couple things that will make it a little bit easier for you. If you don't already, we'll send you home with one of these nice, thick, heavy-duty plastic bag. This will come in handy for when you do put on your stocking, because basically you're going to use this bag, and we'll pretend this is my bare foot. So bare foot goes in the bag, and then you're going to take your stocking And basically the stocking is just going to go up and over the bag. And this bag helps it to slide a little bit easier. Up and over the heel is where it's going to want to get hung up. And then basically you're just going to get all of your wrinkles worked out, get that all the way up the leg. And then this hole comes in handy because now you can pull out the bag out the bottom, and that just makes it a little bit easier because you're going to find that it's going to want to get hung up on the heel. The bag allows it to slide a little bit easier up and over the heel. Now also, this top elastic band, I don't ever like to really see this up against the skin. I've seen some really bad blistering occur from the heat and pressure of that. So I always tell people, roll this away from your skin. Unfortunately, yes, anytime you're up and walking, standing, your stockings are going to want to fall down. So every now and then you're going to have to pull up those stockings, work out any wrinkles. It is going to want to tend to wrinkle behind the knee, and that's typical. So go ahead and work those wrinkles out because that can also pinch and cause some irritation as well. Also, this top elastic band, usually that's to fit kind of the mid to upper thigh of the leg. If it's ever too tight, if it's leaving a red line, a mark, an indentation of any kind, it's too tight. It's actually doing more damage than good. So if that's the case, just go ahead and roll that down a little bit more, loosen it up on the thigh. Last thing we want to be doing is cutting off any kind of circulation. So just let us know if you're thinking that it's too tight or if it's the wrong size. We'll definitely get to the right size before you go home. Now, for laundering. With these, you definitely want to either just hand wash or machine wash them and then go ahead and air dry them. Just hang them on a towel rack wherever. They dry pretty quickly. Don't put them in the dryer. You probably won't get them back on because of the size. Like I said, you'll wear these anywhere from 2 to 6 weeks. After that point in time, go ahead and wad them up, toss them, do the ceremonial toss. You're done with them. But definitely, these are very important. So if your surgeon has prescribed these for you, definitely follow through and wear those. Again, we'll send you home with an additional pair so that you can rotate and launder those for the duration that you get to wear those. Also, like I said, you're on a medication that helps thin your blood. Depending on your surgeon will dictate what medication that is. There are a couple signs of too much bleeding that you will want to watch out for. And usually there's the 3 hallmark signs. If you had a nosebleed that won't stop within 30 minutes, if you're brushing your teeth and your gums start to bleed, not like, oh, I floss my teeth and I get a little bit of blood. This is like your whole toothbrush is bloody. Or you go to the bathroom, blood in your urine, blood in your stool, not normal. You definitely want to call and let your surgeon know that right away. Also, be mindful that you are on a blood thinning medication, so you are more prone to bruising and bleeding. So if you did bump into a coffee table or something, you are going to bruise where you probably wouldn't. And for those of you that shave, just be cautious that if you do shave and nick yourself, you are going to bleed more than you probably would otherwise. So just be cautious. If you have any questions or concerns, definitely call and let us know. Now, despite all of these precautions that we do take to help minimize the risk of a blood clot, some people do still develop a clot. How do you know if you have a clot? That's a good question. So typically you would know that because if you're going to get a clot, most likely it's going to be in the operative leg, in the calf, or in the upper thigh. You can also have it in the non-operative leg, but typically it's in the operative leg. And like I said, you would typically know that because that calf would suddenly become very red, hot, swollen, very painful. And also, if you were to take in a relaxed position your leg and someone were to take your toes and push them up towards your nose, you would want to jump out of the bed because it hurts so bad, accompanied by red, hot, swollen, and painful. Now you guys are all going to have stiff, sore, tight calves. This is different. This is a more intense kind of pain, again, accompanied by the red, hot, swollen. Any suspicion, any question that there might be something going on down there, definitely call your surgeon and let them know. Typically, they would have you come in and do an ultrasound just to verify that. If there is a clot, that's not a terrible thing. We could manage that with medication. The problem is if you do have a clot, it could break free and travel up to the lung, and that's when it becomes a life-threatening event. So that's why we do take this so seriously. So heaven forbid, if you did ever develop severe shortness of breath, pain in your chest, not like, whoo, I'm kind of winded, I just walked up the stairs, but really can't catch your breath, that's a 911 phone call or get yourself to the emergency right away. The chances of that happening, super, super slim, and especially if you're following all of these precautions and doing all of these things to help prevent and minimize the risks of a blood clot. When you go home, hopefully we've provided you with all of the tools and resources to give you a successful outcome for your recovery. However, there might be some times when you would need to notify your surgeon and let them know if you have any questions or concerns. If you have, like we mentioned before, pain that's not being controlled by your medications, or if you have new or a change in your pain, if for some reason you have any suspicion or signs of an infection, like we had talked about earlier, especially a fever over 101, or if you have any problems or changes with your bowel and bladder or issues with constipation, definitely give your surgeon a call. But really, you're going to be the best judge, so if anything to you just doesn't seem right, definitely give your surgeon a call and let them know and ask them those questions. When you go home, know that you're probably going to have some up and down days, and that's normal part of healing. You probably, if you haven't already, had one of those moments of asking yourself, oh my goodness, why did I even have this surgery? This is not what I expected it was going to be. And if you had, great, you've knocked that out early, but just know that that's very common to experience in these first 2 weeks. When you go home, you're probably going to have a little bit more pain, and that's also a normal part of that healing process, so just anticipate that. Again, know that you're going to have these up and down days, and that's typical, so roll with them, know that they're coming. Usually that first bummer of a day usually hits about day 4 or 5 at home, and you're having a little bit more pain, swelling, things just get a little bit harder, so just know that that day's coming and just take that with a grain of salt and muscle through that. Also, it's very typical for patients to be taking the pain medications or the narcotics for about 2 weeks. Usually by then you feel better, you have less pain, gradually you taper off of those medications. What you want to avoid is getting to that 2-week period and suddenly stop taking those narcotics. Your body can go through withdrawal. That doesn't mean that you're addicted to the medication, it just simply means your body's used to taking that, and if you suddenly take that away, your body can go through withdrawal. So over a 4 or 5 day period, just extend the amount of time that you're taking the pain medications each time, or instead of taking maybe 2 at a time, drop it down to 1, and then add some plain Tylenol to help bridge and keep you with good pain control. I will caution you with Tylenol, just be careful that you're following the instructions on the packaging and you're not taking it any more frequently, or you're not taking any other medications that has Tylenol or acetaminophen in it. The latest FDA guidelines recommend that you not take any more than 3,000 milligrams or 3 grams of Tylenol in 24 hours. So just be cautious and be careful to read the instructions on the packaging. Also, driving. That's a big question of when can you drive. Typically, the surgeons will ask that you wait and drive until your 2-week follow-up appointment with them, because again, usually by that point in time you're still taking narcotics and it's not advisable to drive while you're taking any of those narcotics. Also, when you go home, know that yes, you're going to have some of those up and down days. Expect them, know that they're coming. By 2 weeks, things get easier. You feel better, you have less pain. That's kind of a landmark time. But by 6 weeks, that's kind of that magical, oh my goodness, I haven't felt this good in so long. I can't believe I waited so long to have my joint replaced. Okay? It is a healing process. Allow yourself to go through that healing process and be patient with yourself. Don't rush things. If you get into a situation where you have any questions or concerns, please reach out and use us as a resource. That's what we're here for. Or get in touch with your surgeon. It's been a pleasure caring for you, and we wish you all the best and a very uneventful recovery.